There is a moment every evening that most people completely waste, not intentionally, simply because no one ever told them what was possible. It happens right before bed, after dinner has settled, after the lights have dimmed, after the day has wound down. That quiet window, those final 30 to 45 minutes before your body transitions into sleep, is one of the most biologically significant periods of the entire 24-hour cycle. And for the vast majority of people, especially those over 60, that window goes completely unaddressed. My name is Dr. Emily Carter. Today I want to talk to you about something that researchers in nutrition science, neurology, and cardiovascular medicine have been studying for decades. Something that communities in the Mediterranean have incorporated into daily life for generations, not as a health intervention, not as a supplement protocol, simply as part of how they live. And now modern science is beginning to explain precisely why it works. That something is extra virgin olive oil, specifically taking a small amount of it before you go to sleep at night. Now, I understand the immediate skepticism. We have spent decades being told that fat is something to limit, that calories at night are dangerous, that anything beyond water before bed is counterproductive. Some of those conversations have value, but they also created a blind spot, one that is costing a significant number of older adults a very simple, evidence-supported tool for supporting their health while they sleep. What I am going to share with you today is not a miracle claim. I want to be direct about that. I have spent over 2 decades working in integrative and preventive medicine, and I do not deal in miracles. What I deal in is evidence clinical research, peer-reviewed studies, population data, applied practically to real people managing real conditions. And what the evidence tells us about extra virgin olive oil consumed in the evening is genuinely remarkable. Across 5 specific areas of health areas that matter most to adults in their 60s, 70s, and beyond, this one modest habit appears to support the body in ways that very few dietary interventions can match. We are going to go through all 5 of them today, in order of significance, from clinically interesting to truly extraordinary. By the time we reach number 1, I believe you will understand why researchers in some of the world's leading medical institutions are paying very close attention to this ancient food. Let us start with number 5. Number 5, overnight joint inflammation and morning stiffness. If you are someone who wakes up in the morning and has to spend the first 10 or 15 minutes simply allowing your body to loosen up before you can move with any comfort, you are not alone. And more importantly, what you are experiencing is not simply the inevitable consequence of aging. Morning stiffness, aching joints, that dull heaviness in the hands, hips, or knees that makes the early hours of the day feel like a negotiation, these experiences are overwhelmingly driven by one biological process: low-grade chronic inflammation. And that inflammation does not follow a flat line throughout the day. It follows a rhythm. And that rhythm peaks in the hours between approximately 2 and 6 in the morning. This is why mornings are often the hardest time for people managing arthritis, recovering from joint procedures, or simply navigating the inflammation that accumulates with age. The biological environment of the overnight hours is primed for inflammatory activity, and most people go to sleep without doing a single thing to address it. Extra virgin olive oil contains a compound called oleocanthal. It is a naturally occurring polyphenol, one of dozens of bioactive compounds found specifically in high-quality cold-pressed olive oil. What makes oleocanthal particularly significant is how it functions at the cellular level. Independent research has demonstrated that oleocanthal inhibits the same enzymatic pathways that non-steroidal anti-inflammatory medications target. In other words, it works through a mechanism similar to ibuprofen, without the gastric irritation, without the kidney strain, without the blood pressure concerns that make long-term NSAID use problematic for so many older adults. Let me be precise here, because precision matters in medicine. The concentration of oleocanthal in a single tablespoon of olive oil is not equivalent to a pharmaceutical dose of ibuprofen. We are not replacing medication with oil. What we are doing is introducing a consistent, gentle, biologically relevant anti-inflammatory signal during the overnight hours when inflammatory activity is at its highest. For someone who takes the oil regularly, over weeks and months, the effect is cumulative. The research suggests that consistent dietary oleocanthal may contribute to a measurably lower inflammatory baseline over time. And for someone who wakes up every morning already feeling behind, that lower baseline can translate into real functional improvement. Consider this scenario. You are 69 years old. You have been managing osteoarthritis in both knees for 4 years. Your physician has recommended limiting NSAID use because of mild kidney function decline that comes with age. Your mornings are difficult. What your care team may never have mentioned is that 1 tablespoon of high-quality extra virgin olive oil, taken 30 to 45 minutes before bed, is one of the most accessible anti-inflammatory dietary tools documented in the scientific literature. If you are on blood thinners, or if you have known gallbladder disease, discuss this with your physician first. For most older adults, however, this is a low-risk starting point with meaningful potential. Let us move to number 4. Number 4, blood sugar stability. And the dawn phenomenon. Blood glucose regulation is not a daytime-only concern. If you have type 2 diabetes, prediabetes, or if you simply monitor your metabolic health, you already know that morning readings can be among the most unpredictable numbers of the day, and among the most frustrating. Here is something that does not get discussed nearly enough in standard patient education. In the early morning hours, typically between 3 and 7 a.m., your body begins preparing for the demands of waking life. To do this, it releases a cascade of hormones: cortisol, glucagon, epinephrine, and growth hormone. These hormones have a well-documented side effect. They raise blood glucose. They do this whether or not you have eaten anything. They do it while you sleep. This is called the dawn phenomenon, and it is estimated to affect the majority of people with type 2 diabetes, as well as a significant percentage of older adults without a formal diagnosis. You can go to bed with a perfectly appropriate blood sugar reading and wake up with numbers that are 15, 20, or even 30 points higher, not because of anything you did, because of the hormonal environment of early morning sleep. Extra virgin olive oil consumed before bed appears to exert a meaningful moderating influence on this process. The mechanism operates through 2 pathways. First, the monounsaturated fatty acids in olive oil, primarily oleic acid, slow gastric emptying and reduce the speed at which any residual carbohydrates from the evening meal continue entering circulation. Second, and more critically, these same fatty acids enhance insulin sensitivity at the cellular level. Research published in peer-reviewed metabolic journals has consistently shown that populations with high olive oil intake demonstrate measurably better glycemic control, particularly in subjects over 60 and in those managing pre-diabetic or diabetic conditions. What this means practically is that a small amount of olive oil before sleep may help create a more stable overnight metabolic environment. The early morning glucose surge associated with the dawn phenomenon may be less pronounced. Fasting readings taken upon waking may be modestly and consistently lower. For someone who has been waking up every morning, checking their glucose, and feeling a sense of helplessness at numbers that seem disconnected from their choices, this kind of quiet stabilization represents something significant, not just physically, but psychologically. I want to be unambiguous. Olive oil is not a substitute for diabetes medication. If you are on insulin, sulfonylureas, or any glucose-lowering agent, you must speak with your physician before making any changes to your routine. Even beneficial dietary additions can alter medication requirements. That conversation needs to happen. But as a complementary strategy, supported by evidence and introduced with your care team's knowledge, this is exactly the kind of low-cost, high-value habit that preventive medicine should be talking about more. Start with a teaspoon. Observe your readings over 2 to 4 weeks. Let the data tell you what is happening. Number 3 takes us into the cardiovascular system. Number 3. Cardiovascular support during the restorative sleep phase. Your heart does not sleep, but the way it works during the night is fundamentally different from how it operates during waking hours. And that difference matters enormously for long-term cardiovascular health. In healthy sleep, blood pressure drops typically by 10 to 20% during the deeper stages of the night. This reduction is not incidental. It is physiologically essential. It gives the heart and arterial walls an opportunity to rest, to recover, to repair at the cellular level. Cardiologists refer to this as the nocturnal dip, and they monitor it carefully because its absence, a pattern called non-dipping blood pressure, is associated with substantially elevated risk of heart attack, stroke, and cardiovascular mortality. Millions of older adults, particularly those with hypertension, sleep apnea, or metabolic dysfunction, never achieve adequate nocturnal dipping. Their hearts work through the night without adequate rest, and their arteries pay the long-term price. Extra virgin olive oil has accumulated one of the most robust bodies of cardiovascular research of any single dietary compound in nutritional medicine. The PREDIMED trial, a landmark study involving over 7,000 adults at elevated cardiovascular risk, the majority of them in their 60s and 70s, demonstrated that a Mediterranean diet enriched with extra virgin olive oil produced a 30% reduction in major cardiovascular events compared to a control low-fat diet. That is not a marginal benefit. That is a finding with serious clinical weight. The mechanisms behind this effect are multiple and well characterized. Oleic acid, the primary monounsaturated fat in olive oil, reduces LDL oxidation and improves the lipid environment within arterial walls. Hydroxytyrosol, a polyphenol found in high concentrations in quality extra virgin oil, acts as a potent antioxidant directly within vascular tissue, reducing oxidative damage to endothelial cells, the cells that line your arteries. Together, these compounds support arterial flexibility, reduce the inflammatory burden on vessel walls, and create a biochemical environment in which the heart can perform the overnight restorative work that cardiovascular health depends on. The timing of consumption matters here. Taking olive oil before bed means these compounds are circulating in meaningful concentrations during the overnight hours, precisely when the cardiovascular system enters its repair phase. This is not the same as consuming olive oil at lunch. The biological context is different. For those already on antihypertensive medications or statins, the research suggests that olive oil polyphenols do not interfere with these agents. In several studies, they appear to complement them, supporting the same biological pathways through dietary means. That said, always disclose new regular habits to your physician. Medication adjustments may be appropriate as your cardiovascular markers improve. When selecting an oil for this purpose, label information matters significantly. Look for cold-pressed, extra virgin, and if possible a harvest date within the last 12 to 18 months. The polyphenol content, which is what drives the clinical benefit, degrades with heat, light, and time. A peppery sensation at the back of the throat after swallowing is a reliable indicator that oleocanthal and other polyphenols are present and intact. We are now at number 2, and this one addresses something that I hear about from patients more than almost anything else. Before we continue, if you are finding this information useful, please take a moment right now and type the number 3 in the comments. Just the number 3. It lets me know this content is reaching people who genuinely need it, and it helps the algorithm share this information with others in similar situations. It takes less than 10 seconds, and it makes a real difference. Thank you. Number 2, sleep architecture and nervous system regulation. Let us talk about sleep, not the number of hours, but the quality of what happens during those hours. Because for many adults over 60, the problem is not falling asleep. The problem is what happens after. Sleep architecture changes with age in ways that are significant and underappreciated. The proportion of time spent in slow-wave sleep, the deep restorative stage during which physical repair, immune regulation, and hormonal rebalancing occur, declines substantially across the decades. Older adults spend more of the night in lighter sleep stages, cycle through them more frequently, and are far more susceptible to interruption. The result is a kind of sleep that is technically present but functionally insufficient. Hours in bed do not translate to hours of actual restoration. One of the primary drivers of disrupted sleep architecture in older adults is nocturnal blood sugar instability, specifically the cortisol and glucose fluctuations that occur in the early morning hours. When blood sugar drops or surges between 2 and 5 a.m., the nervous system responds. It activates, and when the nervous system activates during light sleep stages, waking is nearly inevitable. This is the physiological explanation for a complaint I have heard from hundreds of patients over the years. I fall asleep without difficulty, but I wake up at 3 or 4 in the morning, and I cannot get back to sleep. I lie there with my mind running. By 6 a.m. I feel like I have barely rested. Extra virgin olive oil addresses this through several converging mechanisms. Its monounsaturated fat content stabilizes the overnight metabolic environment, reducing the blood sugar fluctuations that trigger cortisol release and nervous system activation. Its polyphenol content reduces the low-grade neuroinflammation that research increasingly links to disrupted sleep regulation. And critically, unlike a sugary snack, a heavy meal, or many common bedtime remedies, olive oil does not spike insulin, does not create digestive discomfort, and does not introduce stimulating compounds into the system. There is also emerging research on olive oil's relationship to serotonergic pathways, the neurochemical systems involved in mood stability, and the transition into sleep. The direct mechanisms are still being characterized, but what is established is that chronic low-grade inflammation suppresses serotonin availability. By consistently reducing that inflammatory burden, olive oil may, over time, support more stable mood and more reliable sleep onset. The practical protocol used in most research involving sleep and dietary fat is consistent. 1 teaspoon to 1 tablespoon of extra virgin olive oil, taken on its own, or with a small amount of warm herbal tea, not food, 30 to 45 minutes before sleep. The effect is not immediate. This is a cumulative intervention. Give it 4 to 6 weeks of consistent application before drawing conclusions. And now number 1. The reason I made this video. Number 1. Glymphatic brain clearance and long-term cognitive protection. There is a process happening in your brain right now that most physicians never mention, that most patients have never heard of, and that may be one of the most important biological mechanisms determining the long-term health of your cognition. It is called glymphatic clearance, and it only happens while you sleep. During sleep, specifically during deep, slow-wave sleep, the brain undergoes a remarkable maintenance procedure. The glymphatic system, a network of channels surrounding cerebral blood vessels, becomes activated. Cerebrospinal fluid is pumped through neural tissue at dramatically increased rates, and metabolic waste products accumulated during the day are flushed from the brain and expelled into systemic circulation for disposal. Among the waste products cleared by this process, beta amyloid and tau proteins, the very compounds that accumulate in the brains of individuals with Alzheimer's disease. The glymphatic system is, in a very literal sense, the brain's overnight cleaning crew, and the quality of that cleaning depends entirely on the quality of sleep, the health of cerebral circulation, and the degree of neuroinflammation present in the overnight environment. Extra virgin olive oil has become one of the most studied dietary compounds in cognitive aging research, and the findings are serious. Research published by investigators at Temple University demonstrated that olive oil polyphenols helped preserve memory function and learning capacity in experimental models by reducing neuroinflammation and maintaining the structural integrity of the blood-brain barrier, the protective lining that prevents harmful substances from entering neural tissue. Separately, large-scale population studies have consistently found that populations with high olive oil consumption show meaningfully lower rates of cognitive decline and dementia compared to populations consuming processed, low-fat, or high glycemic diets. What makes the bedtime timing particularly clinically significant is the direct relationship between olive oil's mechanisms and glymphatic function. Olive oil reduces neuroinflammation, and neuroinflammation directly impairs the quality of slow-wave sleep during which glymphatic clearance occurs. Olive oil supports cerebrovascular health, and glymphatic efficiency depends on healthy, flexible blood vessel function within the brain. Olive oil stabilizes the overnight metabolic environment and metabolic instability during sleep fragments, the sleep architecture that glymphatic clearance requires. In other words, consuming olive oil before bed may not simply offer a general anti-inflammatory benefit that happens to support the brain. It may specifically and directly support the overnight biological process most responsible for protecting long-term cognitive function. The timing is not incidental. In the context of glymphatic health, the timing may be the single most important variable. I want to speak directly to anyone watching this who has noticed something changing in their cognition, finding words more slowly than you used to, walking into a room and forgetting what you came for, feeling mentally foggy in the mornings even after a full night in bed. I am not suggesting that olive oil before bed will reverse what may already be occurring, but there is meaningful evidence that it may slow the pace of a process that once significantly advanced cannot be reversed. This is also not a replacement for professional evaluation. If you are concerned about cognitive changes, please speak with your physician. A medical assessment matters. What I am describing is an adjunct, a daily dietary habit, supported by credible research, that may strengthen the biological environment in which your brain performs its most critical overnight maintenance. 1 tablespoon, high-quality, cold-pressed, extra virgin, 30 to 45 minutes before bed. That is it. If any single intervention in preventive nutrition warrants consistency and patience, it is this one. Let us bring everything together. 5 things happen in your body when you take a small amount of extra virgin olive oil before bed each night. At number 5, oleocanthal, a polyphenol unique to olive oil, gently inhibits the inflammatory pathways that drive overnight joint pain and morning stiffness without the side effects of conventional anti-inflammatory medications. At number 4, the monounsaturated fats and insulin-sensitizing properties of olive oil help moderate the dawn phenomenon, that early morning hormonal surge that raises blood glucose overnight, supporting more stable fasting readings for the millions of older adults managing metabolic conditions. At number 3, Olive oil's polyphenols and oleic acid support arterial flexibility, reduce vascular oxidative stress, and create a biochemical environment that allows the heart to perform the restorative overnight work that cardiovascular health depends on. At number 2, by stabilizing blood sugar, reducing neuroinflammation, and avoiding the metabolic disruptions caused by poor food choices before bed, olive oil supports deeper, less fragmented sleep, the kind that actually restores the body and the mind. And at number 1, by reducing the neuroinflammation that impairs slow-wave sleep, supporting cerebrovascular function, and stabilizing the overnight metabolic environment. Extra virgin olive oil taken before bed may directly support the glymphatic clearance process, the brain's overnight system for removing the waste proteins associated with cognitive decline. None of this is magic. None of this replaces the medications your physician has prescribed, the lifestyle changes you are working toward, or the medical conversations you need to be having. What it represents is a single, accessible, evidence-supported addition to the way you care for yourself each evening. 1 teaspoon is enough to begin. 1 tablespoon is appropriate for most adults once tolerance is established. Choose cold-pressed, extra virgin olive oil. Look for a slight peppery finish. It tells you the polyphenols are present. Take it on its own or with warm herbal tea 30 to 45 minutes before sleep. And then pay attention. Not after 3 days, after 4 to 6 weeks of consistency. The body responds to what you give it consistently, not occasionally. If you have a spouse, a sibling, a close friend who is managing joint pain, blood sugar, cardiovascular concerns, poor sleep, or cognitive changes, share this with them. The most valuable health information is the kind passed between people who care about each other. Thank you for watching all the way through. You came here for serious information, and I hope that is exactly what you found. Take care of yourself. The years ahead are worth protecting.